Narrative Theory, a unique perspective of understanding events and behaviors by Cristina Tanase, Antoinette Sanders, Miranda Aultman, and Jill Hodges. What is narrative theory? Theories have been created to provide explanations about human behavior, and they help guide social work practice. Narrative theory suggests that storytelling serves as a way of communication between individuals and a way of transmitting values or socially constructed messages. By listening to client stories, social work practitioners have the chance to learn about their clients' perspectives of events, as well as the meaning attached to their experiences. By getting a better understanding of the client's perspectives about their experiences, practitioners have the opportunity to create individualized interventions to support their clients and meet their needs. Practice principles of the narrative theory. There are 4 major practice principles of the narrative theory. The first principle indicates that people communicate about their lives through the process of storytelling. People are considered to be natural storytellers, and narration is seen as a fundamental quality of human nature. Storytelling could be verbally, in writing, arts, or it might take other forms. The second principle implies that by storytelling, people attribute meaning to their experiences. This allows individuals to interpret and understand their experiences in the context of their lives. According to the third principle, helping people alter the meaning they attach to experiences can be beneficial and therapeutic. Individuals are considered the experts of their lives, and the process of storytelling helps individuals process their thoughts and feelings and provide the opportunity to alter their interpretations of their experiences. Finally, the last principle suggests that storytelling could help individuals understand their experiences in more liberating ways. Often individuals internalize negative messages from society, and exploring with clients alternative ways to perceive their experiences might help them find new meaningful interpretations and more positive views of their experiences. Examples of practice settings, uses, and client systems. Narrative therapy can be used in many different settings to treat many issues of concern with people of diverse ages and cultural backgrounds. Narrative therapy can be used in therapy centers and micro-practice, schools and hospitals at the meso level, and within community centers or other community agencies within macro-practice. Narrative therapy can be effectively applied to treat eating disorders, challenging the beauty standards of the dominant society and narrative. Using art modalities as a therapeutic tool can help clients externalize and name problems. Narrative therapy has also been shown to be effective in treating depression in older adults and children with a history of family violence in groups. Strengths of the narrative theory. Narrative theory is a therapeutic approach in social work that allows the client to write their own interpretation of their personal story. It allows the client to externalize, separate, and view their story as an outsider after it has been written. The narrative theory is multi-storied, which means that there are multiple interpretations of the same event. This allows the client to express their interpretation and then explore the possibility of inconsistencies or other views of the same story. It also allows the client to view their own participation and behaviors in the story. The narrative approach is not only concerned with problems clients face, but it is also interested in the connection between the client and those in the meso and micro levels of social work. It benefits a diverse population of ages who suffer from trauma, mental, and substance abuse disorders, as well as relationship, marital, and family issues. The narrative theory forms an alliance with clients that assesses, encourages, and promotes abilities to enhance relationships with self and with others. Limitations of the narrative theory. Narrative theory is not perfect. There are several limitations of narrative theory. First, the evidence that supports narrative theory mainly comes from small qualitative studies. The lack of larger quantitative studies puts to question whether or not narrative theory is truly evidence-based practice. Second, narrative theory discourages the usage of diagnosing clients due to the social constructs of labeling the client as having a disorder. For example, not diagnosing could be harmful to a client who has schizophrenia and needs medication instead of their thoughts to be challenged. Usually, social workers are encouraged to use the Diagnostic and Statistical Manual of Mental Disorders in managed care settings to determine the best evidence-based treatment to utilize. Narrative theory contradicts this practice. Lastly, the social worker's biases could influence the client's interpretations of their narratives. Due to the client and social worker co-creating narratives together, the social worker could highlight areas that are not areas of interest to the client. Social workers of different race, culture, and gender could be at more risk for misinterpretation without the narrative theory having principles that keep social workers' biases at check.